Good afternoon, everybody. Here it is, a little afternoon on a beautiful Tuesday morning. I'm Dr. Don Batisky. I'm the Executive Director of Pre-Health Advising. And let me introduce my colleague who will be joining us today.
Hi, I am Dr. Kim Molay. I work in the pre-health advising office with the undergraduate students, advising them on their academics and all of their planning and decisions for pre-health.
So I'm going to go ahead and share our screen. We have a few slides to get through today, but not very many. We intend to kind of give you an overview of what our office does on campus. And we certainly want to leave plenty of time for questions. We have maybe a dozen or so slides to get through that will just give you some sort of overview of what we do in pre-health advising. And we will certainly have plenty of time for questions. I will note that we have the opportunity to collect some questions in the live YouTube chat. We'll be monitoring those questions and get to them probably at the end of the presentation. We've got about an hour together today, and let's go ahead and get started. So certainly we want to welcome you to Emory virtually. Move my slide. So this is just an overview of the staff in our office. I introduced myself, Kim introduced herself. We have three other assistant directors. We have Hugh Grant, we have Danny Loppert, and Anil Shetty. We also have a program coordinator. The six of us are often teaming up with others around campus. We have a faculty advisory board that we work with as well. And we try to do what we can to provide lots of opportunities and insights and activities for the students. So what does it really mean to be pre-health at Emory? We know that being pre-health is maybe a little bit different for every single student, but if your son or daughter might be interested in healthcare and would consider after finishing their undergraduate work, wanting to go on to a professional school in one of the areas of healthcare, that could certainly define them as being pre-health at Emory. Students are the ones that are often interested in things that are involved with helping others or serving others. We expect that the students should be able to explain their interests and how it pertains to health. We want them to understand the interdisciplinary nature of healthcare. Healthcare is a team sport. Students need to be willing to self-assess and explore all the different areas within the area of healthcare careers. And they really need to be able to think about a plan, but then also be flexible at the same time. I think you can only look back over the last 6 months and realize that what you might have planned 6 months ago is very different than what we're maybe doing now. I know Kim and I would have likely met you in person. Last year we were in the brand new Student Center. Now we're doing this virtually. So while we might have a plan, we also need to be adaptable and flexible. Students that come into Emory thinking that they might be pre-health probably have an interest in one of the health professions based on experiences they had in high school or maybe things that they've learned about themselves along the way. But they might also have interest in many healthcare professions. Many people think of medicine and nursing as the two primary health professions, but we know dentistry and public health and all sorts of other things, veterinary medicine, optometry, podiatry, et cetera, are some of the areas within pre-health. And on the other hand, sometimes we meet students that aren't quite sure that healthcare is right for them, but along their way, while exploring here on campus, or maybe on experiences they've had away from campus, they have interest. So pre-health is not a major here. It is a mindset and an idea, and we are here to help students explore that. It often comes up, why should students meet with us? We provide resources to help the students with their academic planning, to check in on the progress they're making, to also plan timelines to make sure that they meet prerequisite timelines and making sure that they're also getting prepared for some of the entrance exams. We also know that we serve as a resource when students are trying to look for a sounding board as to whether or not they're ready to apply and what's the best time to apply. We have a group of over 30 peer mentors who are students that have been selected by us and vetted by us and trained by us to be our eyes and ears across campus. And we certainly hope that our students around campus will tap into the resources of the peer mentors. And certainly this is an opportunity to connect with others, even if it's virtually this year or for the foreseeable future. We want students to connect. At the end of the day, we are all about helping the student understand what it is to be a healthcare professional and to get some insights into that career track. And we also know that holistic development is a big part of the puzzle. This is this all-encompassing idea of being a well-rounded student that will be balanced in the classroom and outside of the classroom to try to sort of understand for themselves what it's all about to go for these next steps after finishing up their undergraduate career. We also help students find the kinds of things that they will do in the time outside of the classroom. That includes volunteering, clinical experience, research, working, sports activities, and other hobbies. And we know that this takes time to develop. Another part of that often emanates from being originally interested and involved with some of these activities includes leadership that will maybe come from that. So that will take some time, and we are here to help students navigate this complicated process. It's often a big question of when will students know if they're on track or ready to apply. We know that not everybody is ready at the exact same time. You might be a competitive applicant that's not ready. You might be an applicant that's ready that might not be competitive. A lot of those sort of questions are best answered by people that know you well. So we always encourage students to come in, meet with their advisor, pay attention to the cues and clues that they're getting from lots of aspects of their college career, including grades and activities that they participated in, but certainly maintaining a relationship with a pre-health advisor over the time that the students are here will help them inform themselves as to when they are going to be ready to move to that next step. We have lots of ways to connect with our office. We have a social media presence that includes a Facebook page, an Instagram account, a blog account. We put out newsletters a couple of times a month that will alert students about goings on within the community around Emory, but also things that we hear about that are off campus. And certainly we're looking these days for a lot of virtual opportunities. And then students can certainly make appointments with their advisors. We set aside the individual advisors to have designated parts of the alphabet that your students will already be assigned essentially a pre-health advisor. We'll have, and currently during Add-Drop Swap, have lots of drop-in virtual hours as well as programming throughout the semester, and then appointments with peer mentors as well. So plenty of ways to connect. Right now, we're in the period of Add-Drop Swap when students are sometimes changing up their schedules, and we make every effort to have lots of access. Students have access to us and lots of access for appointments so that students can get those questions answered. Physically, we're located in the B. Jones Center, Suite 204. Which is very close to the Oxford Road Starbucks and the bookstore. Students can also certainly find us on the web, and we expect to be meeting many of them virtually, if not maybe at some in-person events outside in a socially distanced, responsible manner. But that's what we expect over the next several weeks. So it often comes up, and we're going to be very soon done with the slides. Where do our students go after they leave Emory? We kind of look through over the last several years where many of our students go on to medical school in particular. And you'll see some familiar names on the next couple of slides. Without a doubt, we send quite a few students off to schools around the country. Probably 10 to 15% of any entering class at the Emory School of Medicine has students who did their undergraduate work at Emory College, often starting at Oxford College and then moving into Emory. But we send students really across the country to a number of well-known programs, and we're very proud of where our students go. So I think with that, we will stop sharing our slides, and we just want to be available to folks for some Q&A. So let me ask my colleague, Kim. Kim, have you seen any questions in the live chat since we've been here online?
Yes, I've got a couple here. There was a little issue with the audio, so that came up. We could hear you, but then it would, like, the volume would go down. Hopefully, I don't know if that's happening with me now, and I'll wait and see what comes up on the chat. One of the questions that was asked was about the assigned advisor, the designated advisor. Is that mandated? Is that optional? And I can speak to that. I'm an advisor for students with the last names A through H, as Don showed on the overview of our team. And so the mandatory kind of check-in, we call it mandatory in quotes, happens sophomore year. So prior to sophomore year, there isn't an absolute requirement that they come see their advisor. We want them to check in at least once a semester, whether they have a lot of questions or hardly any, just to make sure they understand which chemistry courses, which biology, physics, and other courses they need to be taking in the first few years. By sophomore year, we have a mandatory checkup, which means it's a group orientation. And that's when we get into the holistic development piece that Dr. Batisky was talking about, being well-rounded, not just in doing well academically, but also able to do well, with getting research experiences or volunteering in the community, whether it's virtually or in person. And so sophomore year is when we do require them to do an orientation about all of those aspects of being a holistic applicant. Prior to that, there's no requirement. And then once they become applicants and they're actually ready to apply, we do have some requirements that they go to info sessions and meet with their advisors to learn about the application process.
I see a question about curriculum examples for pre-nursing students. They do exist, right, Kim?
Yes. The examples for students that are pre-nursing, that would be located in a couple places. The pre-health website is a wealth of information where we break everything down into categories of healthcare. So we don't just, talk about applying to medical school. There's a section on our website which is called Explore. There's Prepare, Explore, and Apply. So once you go into Explore, have your student bookmark that page, and then they'll navigate to the nursing section of our website in that Explore area. And then the School of Nursing's website is the best place for admissions information, access to advisors about deciding whether nursing is a good fit, and of course the required courses, which we also have on the pre-health website as well. And the slides will be shared that have embedded links to all of the ways to connect: our website, our blog, our newsletters, and social media.
And the question, sort of a follow-up question to that, about a student coming in declaring that they're pre-nursing, how does that translate into actually being accepted into the nursing program? And certainly that's all well delineated on the website, but if you could speak to that a little bit, Kim.
Absolutely. If you come in declaring, you will be going straight to nursing. Our program at Emory is a direct enrollment program, which means very similar to the business school. The students start with their first 2 years with their liberal arts foundation. They are required to complete all of the different disciplines in their first 2 years before they would apply to the School of Nursing. And direct enrollment just means as long as they've met the minimum requirements, the minimum GPA, which I believe is a 3.0 at this point, and the number of hours that they would need, which is 60 hours. So that's the halfway point. They have 2 years to work on the liberal arts foundation, which is our general education requirements. And they've hit that 60 hours and that 3.0 GPA, they will be direct enrolled into the School of Nursing. It is an application process, but it is nothing to worry about or be concerned about. If there are difficulties with the GPA or getting to the 60 hours, I know the School of Nursing works really closely with the prospective students in assisting them and making sure they're staying in close contact on how to improve their chances for enrollment.
Thanks, Kim. There are a few questions that sort of speak to the times we're in, and I'll try to summarize some of these things, but I would preface it with saying that we really are in an unprecedented time in the history of the world, let alone the history of our country. And certainly the landscape of higher education has really shifted quite significantly in frankly less than a year. And really, I can say that on our campus, less than 6 months. Our students went off to spring break in March this year, and it was during that spring break that we were all informed that there would be an extra week of spring break that was going to allow a couple things to happen. Students were going to be able to come back to campus to sort of clear up what they needed to do and get back home. And faculty were going to shift the rest of the semester into an online virtual format. That really happened not just here, but across the country and the world. And many of you who have students that are starting here as freshmen may have even seen that as they were finishing high school. So with that said, there was a question about how effective will these online labs be? That's a great question, and one for which no one will have an answer yet. We anticipate that our students will be doing very similar things to the people around the country that are in similar situations. In other words, students who are in chemistry labs and biology labs and physics labs across the spectrum of schools, and nobody honestly really knows. I think the faculty have worked really hard this summer to do what they could do to give the students the most robust and useful experience as it comes to online work. But it remains to be seen as to how effective that will be. And again, I speak on behalf of our faculty that I know have worked very hard. We have a faculty advisory board that we work with, and some of them were with us as we reviewed the last group of applying students, because we put together composite letters. And so we're in pretty close contact with faculty, and many of them have been working very feverishly on getting these things done. Kind of another question relates to things like work and research related options. Those I think will also sort of sort themselves out as we kind of roll into this semester. We know that the typical fall semester activities that would have happened a year ago are not going to be happening this year, because we're doing our best to open campus safely and with sort of public health in mind. But if you've not looked at the news in the last few days, probably the sort of highest profile story that I've heard out of higher ed was UNC Chapel Hill. Sort of has just within the last day or two decided to move everything virtual. So, we don't know. We know that many research labs back in the spring were sort of shuttered unless they were doing COVID related research. We've seen sort of a stepwise and very careful opening back up of some of the research labs across campus. And there are guidelines in place for students getting involved with research projects, but it's certainly not as wide open as it would have been even a year ago. I would say the same for any volunteer and service activities, as well as jobs. So I think we're doing our best to try to keep our community safe, and that includes the campus community, that includes Atlanta. But, we also know that, again, you look at the news and we are frankly right in the middle of a bit of a hot spot. So we have to be extra careful. And some of the things that we would have anticipated a year ago are different now. And we'll see how those things sort of play out.
I would just add one thing to that, and then I can take the question on peer mentoring and the percentage of students getting into medical schools. But I just wanted to reinforce what Don was saying, that our number one priority for our students is safety. We don't want any students shadowing, observing, being in any kind of clinical settings without protective gear, and we certainly don't want students putting themselves at any kind of risk at all. So we've been fielding these questions since March about how to obtain research and clinical experiences. A lot of our students have had things canceled that they had planned to do in the summer. And so I think students have gotten pretty creative with virtual opportunities. I've seen a lot of students share with me that they've done online certifications for things such as medical scribing. So those are note takers in different hospital and clinical settings. There are a lot of shortages for things like that. Some of that can be done virtually, at least the training and the certification. So when it's safe to get back in a clinical environment, the student has the readiness to jump into that. But we really want the students to hold off. The medical school admissions committees generally are very comforting and telling us that they understand there's a dip in these opportunities, and this is a time period that, as Don is saying, is unprecedented, and at least in our lifetime. So we know that medical schools and health programs are understanding of this time, and so students have also given me told me about things they've done, like if they had shadowed or had a relationship with a physician in the past, and obviously can't do that kind of thing right now. They've reached out, they've asked, how can I help in any way, to show their service, their commitment. And so some students have been calling patients and families to help offices that really need that kind of administrative help. And so medical schools definitely would see, and other healthcare programs, that effort and that determination to do whatever they can in whatever capacity, but staying safe and doing it virtually is the key. For our peer mentoring program, we are really proud of this program. This has been growing in the last several years. We have so many students, again, they're volunteers, they're leaders on campus, juniors and seniors, who want to engage with the first year students, who want to help them understand the ins and outs of the Emory way of doing things. And so we give them an opportunity to meet with peer mentors through, we have a sort of a matching program that aligns incoming students with a different person that has been through it, that's a junior and a senior, and different areas of pre-health. So, as we said, this is a large umbrella, including not just medicine, but also public health, nursing and mental health, and lots of areas of healthcare. Dawn, do you want to talk about the number of students that get into medical school, or do you want me to take that one?
Well, we can talk about it together. What we see, it's kind of interesting. That's a number that's a little bit challenging to truly know, because we don't always know the denominator. We make ourselves available to every student that's interested, but not every student takes that opportunity, let's say, to come to us. Of the students that we get to know, we know that about half of the entering class in any given year comes to campus thinking they have interest in that broad area of pre-health. And out of that broad area of pre-health, knowing that they can pick more than one potential career, probably 90% at least check the pre-med box, often checking other boxes too. Public health is very big here. We have a very strong School of Public Health at Rollins, but we know dentistry and nursing and others are very popular too. So at the end of the day, we just this year prepared probably, I meet with everybody that's getting ready to have a composite letter, and I met 320, 340 students this year in the spring, a good number of them virtually, from the mid-March point onward. And most of those are students applying to medical school. Now, the composite letter is sort of one of the items that our office prepares as a summary, if you will, of the student's experience here at Emory. And it's generally supplied for students going into medical school, either osteopathic or allopathic, dental school, podiatry, and optometry. Our biggest group is on those going into the medical schools. Dentistry is second, and we will have the occasional podiatry or optometry student, but that's not even every year. We see that if you just look at broad numbers, we always beat the sort of national average, if you will. About 55 to 60% of our students will gain at least one acceptance to a medical school, which is higher than the overall national average. But I would also say that we don't put arbitrary cutoffs on who we will serve. So we will counsel and advise students to consider options, to look at all of their options. But we also know that some students will want to give it a try, maybe against the advice they've been given. And so we support our students through the process, provided they meet all of our administrative deadlines as we work our way through. And then if we
I'm sorry, Don.
slice the numbers up a little bit, I would say that the competitive students, those with GPAs that are in sort of the range of 3.75 to 3.8, with MCAT scores that are sort of 90th percentile and above, we're looking at probably more like 85 to 90%. And what's interesting, there's really never a guarantee. You can look at national level data, and students with 4.0s and perfect MCAT scores don't all get accepted, and people with more modest numbers will sometimes be successful. So we cannot reliably predict what every medical school wants, and we can do our best to make sure the students feel ready and prepared. But at the end of the day, it's not our choice to decide who will be in medical school or not. That's for the schools to decide. Do you want to add something, Kim?
Yes, I was just going to add that we recently analyzed like 3 years of data from our composite letter applicants. And this kind of also goes back to a previous question about what's mandatory, what's required. Everything is opt-in, and we can't control, obviously, students who graduate from Emory and apply to medical school and they've never met with pre-health advising. We want them to meet with us. We encourage it. We require a sophomore year orientation if they want to be eligible for a composite letter. And so the 3 years of data about what we've been seeing is that there is a relationship between the student's preparation and being early in the application cycle, which seems to have some general positive impact. And so we really strongly recommend, encourage, even if students aren't sure exactly which direction to go through our process and work with our advising and go through all of our programming to learn as much as they can. And students a lot of times say, I'm sorry, I have so many questions. And I always say, no, I would much rather you ask me a million questions or come into the office every day than to get information from a bad source or a wrong place. And you start to hear weird rumors about, half the students at Emory are pre-health coming in, and this is how you have to do things to be successful as pre-health at Emory. So we try to break down a lot of the myths and help the students to really focus on building that strong liberal arts foundation, finding their areas of strength where they can make the best contributions. And even if they've known forever they wanted to be a doctor, they still need to explore and stay open and flexible. So they can never ask too many questions, and they can come in as much as they want. And just going back one more time to another question about the peer mentors, I just want to emphasize that in normal conditions, and we'll be back to normal someday, the students just come in, they never need an appointment. They would physically walk in and talk to the peer mentors who are always available, no appointment needed. And so obviously we're doing that virtually now by pairing them up and connecting them, sort of like making that connection easier, since there isn't a physical space to just walk in and talk to a mentor this semester, but there will be. And that's another way, I think, to make our office accessible, friendly, and open to students to ask any questions they want to ask.
Now, I would say that, that is certainly an example of our willingness to not just do things the same way. If we were so wedded on just doing what we've always done, we would just have to forego having our peer mentors involved. But we thought about it and were creative about it and put in a new opportunity for the peer mentors, and they will be more sort of intentionally assigned this year to give new students especially an opportunity to connect with upperclassmen who've kind of navigated this path. We do our best to pay attention to trends. I sit on Emory School of Medicine. I'm on the faculty at the Emory School of Medicine and sit on our admissions committee as an interviewer. And this year, interviews are going to be done virtually. And it's the first time in the history of the Emory School of Medicine and just about every other school of medicine having to gear up for virtual interviews. And this Thursday afternoon, as an example, ordinarily one of the first things we do as part of our fall programming is I've tended to do a big sort of town hall on demystifying the medical school interview, the professional school interview. We're doing it virtually this year. And, that will be different because we've usually done it live in person. And the talk will have to be different because, I've had to keep my eyes and ears open looking for resources that help prepare students for this virtual world. Everything from what's in your background to what you should look like to how you should set up your lighting, et cetera, making sure you have reliable internet access. These are all things that we sort of didn't have to think about even a year ago. So we're trying to be as adaptable as we can to keep the students busy with useful, meaningful experiences that help them navigate this very different world. And it truly is very different. Let's see, a question often comes up about AP credits. Kim, I'll let you take that one.
Yes. And I'll just also say for summer internships, yes, first year students would go through the Career Center. So they can just Google Emory Career Center and they would be able to see a wide range of opportunities for internships. But for AP test credit, we generally want students to take an individualistic approach and not get too locked in or concerned about, I have to do it this way, I have to do it that way, and really assess their strength, their foundation from high school, how comfortable and confident they feel about chemistry. How do they feel about their experience with chemistry at high school? They have the AP test credit, for example, and they're just sort of struggling. Should I just take all my chemistry courses, again here at Emory, even though I have the test credit, or should I apply my credit and move forward? That's an individual question that you'd want your student to sit with their advisor in pre-health advising to discuss. We also work really closely with our academic department. So I would work very closely with the chemistry department in answering those kinds of questions for that student, depending on how comfortable they feel, how confident they feel, and making that decision. I can just give a general blanket, even though I want them to focus on their individual needs, a blanket statement about AP test credit. Generally, if a student thinks they may major in chemistry, biology, a STEM area, or a natural science, then in that case, a lot of times they should apply the test credits and move forward into the upper level advanced courses because they're needing those eventually for their major.
Thanks. There are a few questions that we should be able to simply answer. One asks, are there separate offices for pre-health and pre-med advising? Answer is no. Pre-med is sort of one of the realms of pre-health. So students would access our office for essentially both. If you're pre-med, you're pre-health by definition. If you're pre-health, you might be pre-med, you might be pre-vet, you might be pre-PT. So pre-med is one area of pre-health. Do students need to have a pre-health mentor to be assigned, need to ask to have a pre-health mentor? I think the person was probably asking about peer mentor. That the answer is no, they don't have to ask. We are going to be assigning subgroups with each of the peer mentors. Is there an ideal time advised for the pre-health students to take the MCAT prior to applying to medical school? Yes. And the simple answer is when they're ready. You shouldn't take the MCAT before you're ready. You shouldn't take the MCAT before you've taken the prerequisites that are sort of covered on the MCAT. So again, every student will be ready at a little bit different time. Typically, the MCAT is taken within a few months of when the student is anticipating that they'll be applying. Typically, that means usually spring, early summer before they're ready to apply. But sometimes things like study abroad experiences, gap year experiences, et cetera, may get in the way and may sort of alter the logistics. This year, again, this unprecedented point in our history, there were several students this past spring who were assigned spots and had registered for MCATs, and those MCAT exams had to be put on hold, canceled, moved because of the testing centers were closing. The MCAT is given through the Pearson testing centers, and because they were closing and not able to administer the test, it's not that the MCAT wasn't there, it's just it couldn't be administered at the test centers. So again, you can be prepared, you can do what you can to do what you have in front of you, but then circumstances come up and you have to be a bit flexible. So I know that there are people still in the midst of applying this year who are getting their MCATs taken kind of within this time frame, hoping they'll have scores expedited and turned out in time to be reviewed by admissions committees this year. So it's a very different time.
I'll go back to the AP test credit question. There's another question about test credit for biology. So when students bring in their test credits, they're limited to bring in 12 total hours to apply towards their Emory degree requirements. And so the decision about foregoing and like taking the course at Emory and not using the credit is again something that the student has to decide based on what they think they might major in, how comfortable they feel. So there was a question about someone who wanted to major in biology and wants to use her AP bio test credits. So yes, it's correct. That would account for the lecture and the lab would need to be taken at Emory. Bio is the only one like that with the test credits, chemistry, physics, and other ones cover both the lecture and the lab, but bio does not. So the student would need to do the lab at Emory, but would not do the lecture. And you have to remember test credits are equivalent courses by having that credit posted on their Emory transcript. It's as if they took the course at Emory. And so they should be absolutely fine taking the lab without the lecture.
I think we've covered all the questions.
I think we have, yeah.
We certainly appreciate your taking the time to chime in. Please look at our website. We've really put a lot of effort into providing lots of content. Encourage your son or daughter to look at the website, to reach out to his or her assigned pre-health advisor, to pay attention to messages that come from peer mentors. Our peer mentors really are a great group of students, and they tend to cover the spectrum of potential interests in different health careers. They're not all pre-med, they're not all pre-vet, they're not all pre-dentistry, but we have a mix of them. And I would say they network amongst themselves too. So they may be assigned a given student, but if they find the interests might be better served by another peer mentor, they will certainly turn somebody over to somebody that can network and provide the information needed. So
I'll just add that I guess my final word of advice, actually in the chat, the website is there. So definitely the website is really helpful for students to bookmark. Keep an eye on our blog and our newsletters for all the updated opportunities for either virtual clinical or virtual research or real life experiences as they become safe to do so. And I would just say we're in a unique situation with pre-health advising as a supplementary advising group to general advising. And the fact that we have Dr. Batisky, who's a joint appointment with the School of Medicine, we have a lot of access to his experience, obviously, as a physician, but also experience on the admissions side. And that's a really unique thing with pre-health advising, that a lot of schools may not have that. And we're really proud of that. Access to both what admissions cares about, what admissions folks really look for to be able to properly advise our students. And we stay very closely connected to all the medical schools and other healthcare programs, not just here at Emory, but as you saw on the slides, our students are from all different places in the country and go to schools in a wide variety of places. So very proud of that, that we have these kinds of services for our students, and that they'll have a lot of access to opportunities when the conditions improve and they can just walk over to the hospital and do some shadowing and things like that. So it'll be something to look forward to that is not good to do right now, but we will be excited when we can all get back together again. Thank you.
So one last question, Kim. They're asking if we're going to be adding more chemistry classes. The honest answer is we aren't. Do you know if chemistry is? We're not the chemistry department. We don't.
Yes, yes, chemistry will make adjustments as necessary when the add drop swap period is over, which will happen August 26th. So add drop swap is our adjustment time based on the needs. And the nice thing about Emory being a medium-sized school is that there is not a difficulty generally in getting classes that students want to take, especially in the lab sciences. Now, if they have a lifestyle preference and they have a time of day or a day of the week that they prefer, that can be very challenging. But for the actual class in chemistry or biology, they will not have any problems being able to take those courses. The chemistry department works really closely to look at what the needs are and make adjustments. So I cannot speak for them, as Don said, but I can say with a lot of confidence, it's very likely they will be adding some spots. But we won't know that until add drop swap is ending, which is not until August 26th. So just be patient and tell your students to stay on the wait list and, follow the instructions we've given them about knowing that the registration process continues into that first week of classes. That's okay.
Well, thank you, everybody. And thank you for the thank yous. We appreciate that. I guess we can sign off now, and hopefully you have a great rest of the afternoon, and maybe one of these days we will meet in person.
I hope so. And okay. I will be very excited to meet all of your children, as I call them. I'm a mom, I have a 13-year-old, so I know they're adults now, but we'll take good care of them, and I will look forward to having them back on campus when the time comes when we're all together again. But for now, virtually, they can talk to a real live person, ask as many questions as they want. We are here, we're available. We really want them to reach out and talk to us. So please encourage them to go to our website and get started.
Thanks again. Bye.
Thank you. Bye.